actually reduced to the BRS minimum. We also know that in the last 2 days, the so-called Orosanye report, that is the report that was actually done in 2012 during the regime of President Goodluck Ebele Jonathan to review the entire civil service and the public sector agencies are now reviewed. It has been gathering dust, you know, but now federal government has invited that this be reviewed, and after that review, it has now been put out, and the government and the Federal Executive Council has approved its implementation in total. Now, of course, there are some aspects of that report that has been reviewed, but those that concern the scrapping, merger, subsuming of some of these agencies have already been undertaken. You know, we gave a press conference 2 days ago for you to know. Some of those agencies that are affected are already been put out there for you to all know. Now, the whole idea is that government wants to reduce cost, also improve efficiency in service delivery. Now, this does not necessarily mean that government is out to retrench or to throw people out of the labor market. That is not the original intention. The intention is that efficiency has to be brought in, because some of these parastatals are actually having some overlaps in the way they do their operations. So all these things are, you know, we feel that we should all remind you about some of these things so that you see what government is doing to ensure that Nigerians get the benefit of the democracy. We also, today, like I said, are going to have the coordinating minister for health and social welfare, Professor Ali Pate. The focus is going to be on health. The next time we come again, we intend to have other ministries to talk to you on certain key sectors of government. So I want to, at this juncture, invite Professor Ali Pate to talk to you, and then after which he will have about 20-25 minutes to talk to you, after which you will now have the floor to ask a few questions. But I want to advise that please, in the interest of transparency, accountability, and honesty, keep your questions to the issues at hand so that we don't cast the net so wide and lose the focus of this sectoral press briefing. Once again, I want to thank you for coming, and I do hope that we're going to have a very fruitful deliberation. Thank you very much. Professor Ali Pate.
Thank you, Honorable Minister of Information and National Orientation, for inviting us. And thank you, members of the press, for showing up in large numbers for us to address you in terms of the work of the Ministry of Health and Social Welfare. I'm speaking to you on behalf of my entire team, the Honorable Minister of State, who is not here but attending to other things, the Permanent Secretary, the directors of the ministry, as well as the Director Generals of all our parastatals who are here, because they're here all in full force. And as we go to answering your questions later, if there are difficult questions, you know who to ask, because they are all here. You all are aware that His Excellency President Bola Ahmed Tinubu, as part of his Renewed Hope agenda, put health and the well-being of Nigerians at the center of that agenda of his administration. And when we came into office, after listening to Nigerians through a People's Voices survey, consulting various stakeholders, together with the officials of the ministry, articulated a blueprint. Our goal is to save lives, prevent, reduce physical and financial pain, produce health, and to do so for all Nigerians, so that we don't leave Nigerians behind in this aspiration to have good health and well-being. We articulated a 4-point agenda and 3 cross-cutting pillars. So the report that I will share with you is what has transpired since then in very tangible terms, and we can discuss them. On the first pillar of governance, to improve the governance of the health sector consistent with the National Health Act, we operationalize the national health system with the federal government and states signing a compact in December for the first time that governs the interrelationships between federal government and states to improve the health and well-being of Nigerians, along with the external development partners who are contributing, complementing what government is doing, but aligning with the priorities of government. And in that meeting in December, you all were witnesses when they announced $3 billion complementary to the federal government's effort for the next 3 years to be spent in improving the health outcomes of Nigerians, using primary health care as the basis for that. Of that announcement, we've already signed almost $1 billion in terms of grant, have approval for $200 million complementary grant, and the rest of the $3 billion is in line. We are proceeding with discussions to operationalize them in the context of the sector-wide approach to improve primary health care using PHCPF as a vehicle, and I will touch on it later again. We try to improve the positioning of the regulatory bodies in health, NAFDAC, to strengthen it from maturity level 3 to begin to move towards maturity level 4, so that we make safety of drugs, food that is mandated on us by law to be executed appropriately by NAFDAC, as well as other regulatory bodies, whether it's the Pharmaceutical Council or Medical and Dental Council of Nigeria or the Blood Service Commission, to ensure that the governance function, the stewardship role that we have, is executed as much as we can. And then to do so while responding to the needs of our citizens. So through consultation with civil society organizations, we had several fora with civil society to engage. In addition to the survey, the People's Voices survey that asked Nigerians what is their need and how do we respond better. That citizens orientation, you'll agree with me, is one of the key pillars that the President has directed us to do, to respond to what Nigerians are actually yearning for. And we intend to continue in that direction. Now, the second pillar on improving population health outcomes, we're laser focused to improve the primary healthcare system with the interventions, preventive and curative interventions that will improve health outcomes, as well as our hospitals. We're expanding the primary healthcare centers that are benefiting from the Basic Healthcare Provision Fund from 8,000 that existed until now, some of which are not entirely fully functional, to make them functional and expand them to 17,000 by the end of 2027. And the primary healthcare centers, with the support of the federal government, complemented by the states, are delivering antenatal care, skilled birth attendance, immunization. And you will all recall, last fall we had an outbreak of diphtheria in Nigeria. It was in 14 states. By August, September, it had been going on for 9 months. Now, the diphtheria outbreak has receded. What have we done? We immunized 5 million children with the pentavalent vaccine as part of the diphtheria response, and 10 million children between the age of 5 and 10 with TD vaccines, so 15 million doses of vaccines. And that has curtailed the diphtheria outbreak, not as much as it was in August and September. In October, we launched the first phase of the HPV vaccination in 15 states. In the 15 states where this vaccine was launched to prevent cervical cancer, at least 4.95 million eligible children were immunized. That's 80%. That is an impressive performance by Nigeria for the first phase states. The second phase states will start their vaccination in May this year, and preparation is already underway, learning lessons from what had transpired in the first phase. And with regards to the Basic Healthcare Provision Fund, we've strengthened the fiduciary system so that the resources that will channel to the primary healthcare centers will indeed reach the primary healthcare centers and serve Nigerians. And we've had discussions with the Governors Forum, with the National Economic Council, and with the President's direction, we are tightening up the fiduciary system so that when we disburse 50 billion by the end of this first quarter of 2024, to the primary healthcare centers through the MPHCDA gateway or the NHIA gateway, the resources will indeed reach Nigerians and will be subject to social accountability measures so that we see the impact of those resources that are coming from the federal government's portion of the federation account. That's the 1% CRF. In addition, over the last several months, 2,497 doctors, nurses, and midwives have been recruited in our primary healthcare centers to fill gaps and to help in delivering services. And hundreds of thousands of Nigerians have been enrolled in the health insurance program through the National Health Insurance Scheme and the Vulnerable Groups Fund. We increased the quota for the schools of training of nurses and midwives. We doubled it. And we're working towards increasing that for other health cadres as well, so that we can increase the production of health workforce that we need. We know that in many parts of our country, we're struggling with that. In addition, we spent time to build an approach to invest and renew the health infrastructure in our hospitals. Recently, as you are aware, the President approved, in fact, the infrastructural upgrades and equipping of 6 cancer centers in the 6 geopolitical zones in collaboration with the NSIA. That is in the 2024 appropriation of the federal government. In addition, there are 8 diagnostic centers and 2 oncology centers that the groundbreaking ceremony will be conducted very soon as part of the renewal of the health infrastructure in federal tertiary hospitals. And if you look at the 2024 budget, basically it's towards physical upgrades, equipment upgrade, training of the health workforce. And then repositioning of the NHIA from the point of view of the financial protection to ensure that the mandatory health insurance scheme takes off. This has been going on for more than 40 years. Nigeria has not made enough progress, but with the new leadership in the National Health Insurance Authority, we are very confident that that progress will come. On the third pillar of agenda to unlock the healthcare value chain, there are several work streams under that agenda to improve the environment for manufacturing of diagnostics, pharmaceuticals, biologicals, devices, health services, health technology. And we've made impressive progress in that direction because we have at least 3 entities that are coming in to Nigeria. A Brazilian company committed and has approved $240 million investment in the generic pharmaceutical industry. And we have diagnostic companies that are coming to establish manufacturing plants. We already have one that is established in Lagos, which we launched in December. And in addition, our local manufacturers, local pharmaceutical manufacturers, we engaged with them in Lagos, we engaged with them in Kano, and as we speak, the President had directed the Attorney General of the Federation to develop an executive order on the policy measures to reduce the barriers for them to manufacture, to protect the industry that we have, while reducing also the cost of pharmaceutical, which is biting alongside the cost of many other commodities and inflation that we are facing as a country. All these efforts are long overdue. If we had unlocked the value chain of Nigeria's health sector 10 years ago, for instance, these issues would probably have been mitigated. So we're playing catch up as a country, but this administration is very committed to engaging on those issues frontally. Most recently, we signed a $1 billion MOU with the Afrexim Bank to help unlock the healthcare value chain. That was last week. And essentially, it's not money to the government. It's money to be available for investors and participants in the healthcare value chain so that we can manufacture, produce materials here that will be useful, that will be effective, but also retain the economic value and create jobs for Nigerians. So health is not only a consumption sector, but it can also be a productive sector. And I think that direction, consistent with the President's direction and his agenda, I think will be unfolding very soon with this mobilization that we have. The fourth pillar of our agenda is on health security. That is an important element that all of us, regardless of which leaning you have in this country, health affects you. We saw that with COVID. We saw that with Ebola. If there's one thing that should reunify us, consistent with the President's direction, I think is around health and health security. Because there is link between health security and economic security and national security. And in the last few months, you've seen us try to reposition the Centers for Disease Control to be able to preempt, prepare, and be ready to respond to outbreaks. We adopted a One Health approach because it's multi-sectoral. So with collaboration between Ministry of Health and Social Welfare, anchored by the NCDC, we brought in Ministry of Agriculture, Ministry of Environment, Ministry of Water, Resources, to work together using the One Health Steering Committee platform to think of spillover events, because there are many diseases that jump from animal arena to human arena. Most recently is the issue of folks eating fruit bats in one of our states, where the bats had some antibodies that showed they were exposed to some infectious agents. So preventing that, we had a joint risk assessment and tried to mitigate that. And in addition to that, there are outbreaks that we're dealing with every day. It's not only Nigeria. Every month, tens of outbreaks are reported all over Africa. But in Nigeria, we're tightening our approach so that we are sensing early, have good surveillance systems, and be able to respond. For instance, Lassa fever. Lassa fever is a perennial virus that affects many Nigerians. It's been going on for 40 years. Lassa is a town in northeastern Nigeria, after which the virus itself was named. It's very prevalent all across West Africa. Every year it happens. Two things. This year there are at least 2,400 folks who have been infected. And so recently you had some cases from Kaduna and a few other states, almost 24 states. This is a virus that is transmitted because rats live close to human habitations, contaminate foods, and lead to this viral hemorrhagic disease that has high case fatality. In anticipation of this year's Lassa outbreak, in October, November, we pre-positioned resources at the NCDC. Pre-positioned materials, PPE, personal protective equipment. We also pre-positioned ribavirin, the antiviral drug, and the testing for that, so that we're able to respond quickly. But there's a wider issue of awareness with you, the members of media, will need to inform Nigerians to keep food away from rats that are encroaching in human habitation. While we on the health side are taking measures to ensure that we're appropriately responding. In addition, in November, we launched a task force to start working towards a Lassa fever vaccine development in Nigeria, chaired by the NCDC, the NAFDAC DG, our development partners, to start conducting studies to understand the epidemiology of Lassa fever, because we know there are candidate vaccines, so that when the vaccines are developed, they are manufactured in Nigeria, that they are safe and effective, and they're deployed in Nigeria. That task force is doing its work currently, so that in the future, when we have vaccines, people can take the vaccines against Lassa fever, that we don't have to lose people every year, lose health workers, unfortunately, from this virus. Meningitis. Many years ago, we used to have tens of thousands of meningitis every season because we're in the meningitis belt of West Africa. But because of the intense efforts to vaccinate, much of those outbreaks have now become history. This year, there are reported outbreaks, but we are able to, with our partners, sense where those outbreaks and mobilize. And in fact, before we came here today, we are trying to mobilize vaccines for the meningitis that came out in Yobe State, for instance, where to mitigate it so that it doesn't spill over. Because in health, in other sectors, when there is success, it's in things that have happened. But in health, our success is in things that have happened, but also a lot of our success in things that have not happened, in badness that does not happen. So when we prevent meningitis, and you have 100 cases, well, it's sad, it's tragic. But without the interventions that we are making, it could have been thousands. When you see Lassa, 2,400, it's unfortunate. And we'll respond to that, and we're responding to that. But without those interventions, it could have been much more in numbers. So you have to also factor that in the assessing what the ministry has been doing. And I believe that the issue of health security is so vital, and that we needed to work with our colleagues and the states. And at the National Council on Health in November, we did pass a resolution encouraging all state governments to also set up their public health emergency operation centers so that we coordinate better. When there are crises, we get the data, we know where it is, and we mobilize the resources. I will end by mentioning the cross-cutting pillars of our effort on data and digital transformation. And very soon, we'll launch a team that will be conducting an intense effort, and we have it in our 2024 budget, to begin to use digital technology to leapfrog in our health sector. That will be a collaborative effort by different parts of government, including the Ministry of Digital Economy. And my colleague, the Honorable Minister of State for Health, will be leading that effort. We had also, as I earlier mentioned, the sector-wide approach, the compact that we had developed, is to defragment the sector. Until this administration, the sector was hyper-fragmented. Everybody was doing what they really wanted to do, including some of our development partners. But thankfully, over the last several months, we have had really good alignment. Our partners are saying, what is government's priority and how do we support that? and how do we work with the state governments and to achieve results, and we'll be reporting on those results on a regular basis, in addition to the statutory requirement of the state of health, which is provided for by the National Health Act of 2014, but had never been done. But this administration is working towards doing that. The National Consultative Forum on Health and Human Capital is also provided for by law. That has not happened. So we are organizing to have a consultative forum of all our traditional leaders, religious leaders from all parts of the country to engage them on these reforms that we are making. Now, I do also want to mention for NHIA, the National Health Insurance Authority, because it's not just about insurance. We all insure our houses, our vehicles, and all of that. Health insurance is so vital because it is something about financial protection. The cost of ill health can tip populations to poverty. There are many Nigerians who are suffering from the catastrophic expenditures because of ill health. So expanding health insurance is a key priority of this administration. And we're repositioning the NHIA. And while doing that, they've been focusing on increasing the enrollment numbers. And I believe in the last several months, more than 750,000 Nigerians have been enrolled. These are new enrollees. As part of the reforms that we're pursuing, you cannot insure people that you don't know. So identifying them and ensuring that, in fact, we count them properly while we're expanding the public revenue to provide the protection, because you cannot insure someone in abstraction. Somebody has to pay for it. And federal government is putting its resources, and we are encouraging states also to pay the premiums for their own formal sector employees, and then other innovative financing arrangements so that we pool and provide cover for the poorest Nigerians, so that those who are traveling abroad, for instance, for medical care, at least we should also think of those who don't have the resources to travel abroad, because the inequality in distribution of health outcomes in Nigeria is very stark. While we're expanding the infrastructure in health, we hope people will not travel abroad, and that some of the $2 billion that we spend in medical tourism abroad will be returned at home. But at the same time, we have to ensure that the poor Nigerians as well have some protections so that they get the basic care as well as hospital care when they are needed. And we're mobilizing in that direction. I think, Honorable Minister, I will stop here. And members of the press, you can now ask your questions. As I mentioned, my colleagues are here. So I will take the easy questions, and the most difficult ones I'll ask my colleagues to answer. Thank you very much.
Thank you very much, Honorable Minister. Like we said, this is going to be a question and answer session, but I just want to make a small amendment about the talk I made on the Orosanye report. I wanted to say it is also called the Orosanye report, not so-called. It is also called the Orosanye report, just for you to note and amend in your submission. And at the end of it all, the speech or the presentation of the Honorable Minister, he has made it, and then it will be distributed for ease of reference for you. It's also important for you to know that my remarks are also being produced here, and it's going to be circulated for ease of reference. Thank you. You may now continue.
Thank you very much, Honorable Minister. I listened to the coordinating minister towards the tail end. He said, we are repositioning. And when you reposition, it's for good service delivery. Information, they say, is power. Correct information brings clear thinking. And clear thinking helps people to make sound judgment. I want to thank you so much for that wonderful presentation. Thank you so much. While the presentation was going on, let me say that the Director General of Federal Radio Corporation of Nigeria, Dr. Mohammed Bulama, just walked in. You're welcome, sir. Thank you for coming. Also with us, we have the Managing Director, News Agency of Nigeria, Mr. Ali Mohammed Ali. Thank you for coming. Thank you so much. We welcome the presence of the Director General, NCDC. Please, wherever you are seated, you may please rise for recognition. Please, thank you so much for coming. At this point, we are moving into a very important segment of this press briefing, which of course is the question and answer section. For those of us who believe in developmental media practice, at this critical time, the media is expected to play a supportive role in the implementation of policies of government. I want to say at this point that we agree that the media sets agenda on matters of public interest. The health sector is a critical sector in Nigeria. At this point, very distinguished ladies and gentlemen, like I laid from the beginning, we are moving into the question and answer segment. Please, if you are recognized to speak, you tell us your name, the media organization you are representing. And please, restrict your questions or your comments to the issues addressed by the Coordinating Minister of Health and Social Welfare in his presentation. Let us be decent in the use of language. Please, I want to plead with those of us at the back, let us maintain a very good silence to enable us have a robust interaction in the course of this segment. At this point, very distinguished ladies and gentlemen, I want to declare the floor open for your questions, please. 1,